A C3 spinal cord compression. What does that present like? What is that? All right, my name is Dr. Nelson. I'm a physical therapist, and I'll be talking a little bit more about a C3 spinal cord compression. C3, that is the location where that spinal cord was compressed. So if you look at your spine, you have bones going all the way down. All right, so you have cervical bones, you have thoracic bones, you have lumbar, and you have sacral. In the cervical region, there's 7 bones. All right, there's C1 all the way to C7. And in this specific situation, this person had a compression of the spinal cord at the C3 or the third cervical bone or vertebrae. All right, so when this occurs, the spinal cord, it gives motor and sensation to the rest of the body. So when there's a C3 compression, everything below that has been compromised. When I mean by that, I mean motor and sensation. So how can this be compromised? It could be done through an accident, maybe a whiplash injury, car accident where you mess up your spinal cord. Maybe it's a injury from a sporting event, maybe play football, you compress that C3. Maybe it's the bulging or displacement of the disc. Maybe it's spondylosis. Maybe it's an abscess. Maybe it's a tumor. These are all things that can compromise that C3 nerve region. So my client, I won't discuss why or how they injured the C3 region of their spinal cord, but how do they present? They present with gait disturbances, so weakness in their trunk and everything below that C3. So you're talking about your shoulder, there's weakness in shoulder, arm, hands, loss of sensation, numbness, tingling, weakness in bladder, bowel, all of the above, right? Difficulty with everything. So it depends how severe this compression is, that kind of gauge this specific client in regards to the treatment. It could be surgical or non-surgical. When it's completely severe, they have to undergo surgery. And that's the case for my client that I'm seeing at this moment. He had to go in and get this surgery, right? The surgery where it's in a space that they can fuse it. So they fuse it, or they could do a laminectomy. And that's just a fancy surgical word for removing part of that vertebrae so you can release that nerve root. So they can have that sensation and that nerve working again. So this individual, it is so hard and so tough because at this moment, he's about 6 months out and he's still having weakness in his hand. He's having difficulty walking and he's lost his confidence. And this is why I'm wrapping it up and I'm bringing it back to confidence, the importance of confidence. When I come into a person's